Moving on, let us discuss the common forms encountered, such as the cover sheet, medical abstract or discharge summary, PhilHealth Claim Form 2, 3, and 4, the tagubilin, prescription, the operative technique, treatment protocol, and hemodialysis sheet. So let's discuss them one by one. So first is the cover sheet. I would like to remind everyone to please fill up the important details such as number 1, the complete principal or final diagnosis and other diagnoses with their respective ICD codes. So one diagnosis is to one ICD code, and the primary problem of the patient should be written first. Next is the list of procedures done with their respective dates and RVS codes. So reminder, it is important to note that the exact details included in the cover sheet should exactly match what is written or included in the medical abstract, CF2, CF3 if applicable, CF4, OR Tech, and tagobilin. In the wards, may mga nagsusulat ng diagnosis and procedures without ICD and RVS codes. Now that we know, kindly supply the codes too in this form. Or meron din ng pagkakataon na 2 to 3 lang yung diagnosis na nakasulat sa cover sheet. Pero madami yung nakalagay sa medical abstract. So that is considered inconsistent documentation. So what else should we fill up in the cover sheet? We also need to accomplish the admitting physician, attending physician, and consultant in charge, especially for pay patients, by affixing your signature and MD stamp. And lastly, check what applies in the disposition and result of the patient. Next is the medical abstract. So as mentioned earlier, the complete admitting and discharge diagnosis should be written here and must match what is written in the cover sheet. Also, all the procedures done in the patient should be enumerated here with their dates, such as the major surgeries, minor or bedside procedures, blood transfusion, hemodialysis, chemotherapy, and the like. Next is the clinical history. So aside from writing the chief complaint, a complete and concise admitting history should be written. Signs and symptoms enumerated should reflect that the patient really warrant a hospital admission. So reminder, for trauma patients, aside from the noi poi doi toi, or the nature of injury and the like, kindly include the circumstances of injury, such as is it a traffic or self-accident, is it a fall, mauling, or industrial or work-related injury. Also write what is the position of the patient. Si patient ba ay driver or passenger, or siya ba ay pedestrian, kung sa mauling siya ba ay victim or siya yung assailant, or for traffic accidents, yung both vehicles ba is in collision or he was just run through by a moving car, parang ganun. Tapos, maganda, nakasulat din kung ano yung activity of the patient during the injury. For example, while at work, ganyan. Tapos, or while at home. Next is, also ilagay din natin yung weapon or material causing the injury, because all of these are necessary for ICD coding. Iba ang code if the injury happened at home, iba kapag nasa public place or sa restaurant, iba kapag while doing work-related activity or while at leisure activity, while at sports, iba-iba yung codes kapag ka ganun. So, dapat nilalagay natin yung ganong circumstances of the injury. Next, for OB patients, if with other illness yung minamanage natin aside from delivery, i-enumerate din natin dapat yung signs and symptoms na related doon. For example, preeclampsia. So, enumerate din natin doon yung ano yung signs na meron si patient. Like, while at labor, she was experiencing headache, dizziness, nausea, vomiting, etc. Yon for the gestational DM also, and etc. Example, for a patient with appendicitis, meron kami nakitang abstract na ang nakalagay lang is positive abdominal pain, positive nausea and vomiting, hence admitted. So upon checking ng PhilHealth officer, they might say na hindi naman lahat ng may sakit ang tiyan at ng susuka ay ina-admit. So maaring hindi pumasok yun sa criteria nila for PhilHealth claims for appendicitis. So in that case, possible na hindi tayo makaklaim for that particular patient or they will return the chart to our hospital. Next also, for OB patients, we may have received claims sa delivery pero questionable if makaka-claim for pre-eclampsia kung no symptoms upon admission yung enumerated natin sa abstract, sa history. Lalo na if ang nakalagay sa, kung kunwari walang nalagay na physical exam sa medical abstract or ang na-encode sa CF4 is normal yung BP. So, hindi tayo makaka-claim for that. Next is the physical examination. This part is oftentimes forgotten. History lang ang nakasulat, so reminder na lagi itong isusulat. Kasi maaaring yung signs and symptoms na nakalagay sa history does not always warrant admission. Pero sa vital signs at physical exam pala is admissible na talaga ang patient. So i-remind lang namin yung mga department na naka-template ang abstract na ito yung part na minsan na miss out. So better ma-avoid sana natin yung paggamit ng template or kung hindi naman natin maiwasan kasi para mas mabilis, i-update nyo yung template nyo na i-include na yung physical exam, lalo na yung fundic height, FHT for gravid patients, lalo na yung IE findings at the time of admission. Next is the diagnostic findings. So all the pertinent diagnostic results that support the diagnosis should be included in the chart. For example, ultrasound for pregnant patients, cranial CT scan result for stroke patients, chest X-ray for patients with pneumonia, CT scan for patients with mass, X-ray for patients with fracture, RT-PCR for COVID patients, blood CS for patients with sepsis, urine culture for complicated UTI, 12-lead ECG for MI patients, and 2D echo for patients with CHF, and the like. So, any laboratory result that would support the diagnosis, mapapatunayan yan nun yung diagnosis na nakasulat sa final diagnosis, dapat meron siya sa chart. Next, course in the ward. So, ideally, all the important ward events should be enumerated here with supporting PE findings leading to a certain treatment or management and the patient's response. But for patients with long duration of hospitalization, ang gusto nating ma-reflect dito is yung pertinent hospital days where the patient undergone procedures, whether minor or major, blood transfusion, chemo, intubation or resuscitation, deterioration, or etc. So, the details here must justify the length of admission of the patient.